Hello, good evening, everybody. Sorry for the delay. So, I wanted to talk to you guys a little bit about acne today. So, what is acne? Well, the usual kind of acne that I end up seeing and treating in clinic is acne vulgaris. In other words, that's where these little pores on the skin, usually around the chin, forehead, the so-called T-zone, those areas basically they get clogged up with this waxy white substance that the pores produce. And then the pores get clogged and builds up this environment where a particular bacterium, acne, P. acne, tends to live in that environment. So this is something that is a very hot topic here in Florida this time of year, especially since right now it is very hot and humid, and so it's very common for folks to get their acne on, so to say. Now, acne is one of those things that is actually very much influenced by our hormones. And it can be influenced by, for example, the female hormones as we go through the cycle of having the periods, and our own hormones rise and fall during those times. And it's very common that a few days or a week before the period that the acne comes out as a part of that. And so that's one of the reasons why sometimes a dermatologist will actually prescribe certain birth controls. Yaz is one of the most commonly ones that's used for that, because when the birth control is regulated, the hormones are more regulated, and then the skin doesn't do that as much. The other place where the acne comes out is sometimes if there's other things that cause extra hormones, for example, PCOS or other conditions where people's hormones get a little bit out of whack, it also can influence the amount of acne that they suffer from as well. So it is certainly something that if you're suffering from it and you can't have, and you're having trouble getting rid of it, then please, of course, talk to your physician and get some tips and learn some medications and things like that for it. So as far as the hormones go, there's another big source of hormones in the Western diet, and that is in the meat and the dairy. The dairy is actually the prime offender. I've had many teenagers that eliminated dairy at all from their diet, and they found a significant improvement in their skin just from that one little change alone. So when they have all those advertisements saying got milk and they got that little mustache, well, they probably should replace it with got acne and a little mustache of and beard of acne, because it is just that common. And ironically, the skim milk is actually even higher in hormones than the regular dairy as well. And part of that, it has to do with just how the milk is processed. When they spin the milk down in order to cause the milk fat to be removed, they also tend to concentrate what's left in the bottom part of the milk. And in that bottom part of the milk happens to be hormones. And so ironically, even though sometimes teenagers or adults will choose skim milk thinking it's way healthier, it's actually much more concentrated in the hormones that are driving the acne as well. Also, high-fat foods in general, and dairy is one of the most common abundant sources of saturated fat in our diet in the West, for those that still take it. So dairy and meats in general, basically they cause our own hormones to go awry. The milk and dairy causes a hormone called insulin-like growth factor to get elevated within a few hours of consumption, and that tends to trigger the outbreaks of acne as well. It's kind of a fun thing. I have known this stuff for a little while, and I gotta say, I call myself 99.9% plant-based because once in a while I might have a little something here and there. that's not strictly on the diet pattern. And I notice within a few, literally a couple of hours, if I happen to have something that contains cheese, for example, a few hours later I'll notice little acne bumps popping up because I'm not immune as a human being with the same hormones and everything. And it serves as a reminder when it happens that, yep, that's happened again, and that's exactly what the research has shown. So there's another hormone signaling system that is talked about on the nutritionfacts.org website. Now, there's a beautiful article, summary article on acne on there, and that is the TOR signaling system. So the short version is this TOR signaling system is a very widespread signaling system inside the body, and really all you need to know about it is that it's associated with a bunch of stuff that most people don't like. For example, obesity, diabetes, Alzheimer's, and breast and prostate cancers. It basically seems to be one of the driving mechanisms that causes these things to occur. And basically, cow's milk has a very high concentration of a amino acid named leucine. And leucine is, I guess if you want to think about Lucy and Charlie Brown, leucine. Kind of like Lucy and Charlie Brown, it's not necessarily the nicest thing when it comes to some of the way the body signals things. And it's the driver of that TOR enzyme. And so basically, it's a system that is necessary in the body, but when you start really driving it and pushing it, then it can lead to some of these disorders. So that's another reason why I usually recommend people pretty much staying away from the dairy in general, because for the women, potentially can stimulate the breast cancer type of things, especially if they're prone to hormone-sensitive tissues that can be stimulated by these hormones. And similarly with the men, these hormones tend to stimulate overgrowth of the prostate. And so anything that stimulates that TOR system too much can cause too much stimulation of these hormone-sensitive tissues. But wait, you might be saying, what about my cow in the backyard that I am having organic fresh milk from? Well, sorry, even a backyard cow that is grass-fed and all the right stuff, yes, it's probably going to be healthier in comparison to the conventional dairy that you have at the grocery store. However, it is still a pregnant female cow lactating because it's got hormones to lactate, and you still are getting plenty of hormones in that as well. And when they've tested it, the hormone content from even the organic milk is the same as regular full-fat dairy that you get at your grocery store. There's another neat little study that I've quite enjoyed. I think it was February of 2016 was when Dr. Greger came out with this one. And there's a little dried berry called a barberry. And it's something I'd never heard of, and I'm a little of a foodie curiosity kind of person. And so when I learned about this berry and how it's potentially helpful for acne, I went on Amazon and found some and got it over. And basically this is a Middle Eastern fruit, and it's very common in Middle Eastern countries where the girls and the boys drink a juice called barberry juice. And it's kind of like a cranberry. It looks red, it's small, and when you get the dried barberries, they taste very tart. Now these are extremely healthy. They're very, very packed with antioxidants and stuff, so even and above their ability to help combat acne, they also are very healthy for the body anyway, and so it's kind of a win-win situation. But basically they found that just a teaspoon, a very small amount, just a teaspoon of dried barberries led to about 43% reduction in the amount of pimples that the people were having that were consuming it. And that's just, I believe it's 3 times a day that they had a teaspoon of barberries. And because they are very tart, they do have a little pucker factor. So sometimes people might like to mix them with other foods such as oatmeal, or I kind of like the pucker factor, so I just kind of eat them directly whenever I think about it. So it's just kind of for fun now for me, because as I've been practicing the whole food, plant-based, no or little added oil diet pattern, I found my skin has cleared up tremendously, and so it doesn't really need anything extra at this point. But it's kind of fun to play around still with these things. And so the barberries and barberry juice, they're very cheap right now because it is just a very common food in certain parts of the world. And if you're having just a small amount every day, even a box, from something like Amazon can last for quite a while. So other kinds of things that can be helpful to remember when it comes to acne and stuff is there's a couple of very common things that I talk about in clinic with folks that have concerns with acne. And some of them are just kind of basic skincare stuff that is helpful to know. But if you never talk about it, never get exposed to information, then it's not quite as simple, right? And so first of all is rubbing the skin tends to not be very good when the skin is irritated. So if an area has got acne, or even if the skin doesn't have acne, but you're like using an abrasive sponge, or if you're using something that's harsh on the skin, then it can actually cause acne to come out. And I can tell you, I've had some experience with that. Just a quick story. I was over here at one of the local dermatologist's offices. Oh gosh, that was probably close to 8 to 10 years ago, actually. No, it was in 2005, 2006 timeframe. So yeah, before I even graduated medical school, a long time ago. And I was doing my rotation over at the dermatologist's office. And of course, this was long before I discovered a lot of the stuff that I'm talking to you guys about tonight. I was having some issues with acne. And here I was working with a dermatologist who was hooking up all of his patients with these wonderful compounds. One was Retin A and the other was benzocaine. So these are actually still some of my first line methods to help with acne, in addition to diet and lifestyle stuff, of course. And the key things with Retin A, by the way, is a lovely thing for the ladies. It does reduce and prevent fine lines and wrinkles, which is why it's very popular in various forms in skincare creams amongst the folks that go on TV a lot and so forth, because it's kind of an anti-aging cream. But anyway, the thing it does for the acne is it causes the skin to turn over more quickly. And if you're not used to bright sunlight exposure, I came down from Massachusetts and entered the wonderful, hot, humid climate with a bright sunshine of Florida. Anyway, that combination plus the Retin A, I learned from personal experience that if you start off with, all right, I'm just going to slather a ton of this stuff on, and then the next morning I'm going to slather on the benzocaine, which is another very, very basic acne treatment, benzoyl peroxide and clindamycin kind of combined. There's various forms of it, but that's just one brand name of it, very common in clinics. And sometimes they separate them out, so you have one or the other. And use that during the daytime, and the benzoyl and the Retin A at nighttime. I'll tell you, the long weekend happened. I came back after, something like the 4th of July weekend, and basically I was peeling from the Retin A, and so I thought, oh no, I'm peeling. I should get one of those apricot scrubs or something. So I'm scrubbing and trying to get all the peeling off, which of course made it happen even worse. And so next thing you know, everything's covered with little red bumps, and I look like a lobster because I'm basically totally red and everything. And so basically I came into clinic and I was so embarrassed because here I'm in a dermatology clinic as the medical student with like a totally red blotchy face. And I just look at him and like, kind of like that puppy dog look, like, what did you do to me, sir? And he just laughed and he said, yep, but it worked. It got your acne down. And sure enough, the bumps of the acne were down, but it was a little bit too intense of a treatment. So I warn everybody, when you use these medications, most of the medications that you get from your dermatologist's office are going to make the skin more sensitive. And so 2 ways to combat that. One is to wash the face with cool water, because if you take a hot shower or use hot water right before you put these medications on, it actually makes the skin much more absorbent, and it will really soak up that medication and really get expressed for it, which you really don't necessarily want if you're starting off with some of these medications. So part of the key thing is when you use the medications, just splash the face with cool or lukewarm water and use some soap that's kind of designed for the face. There's a bazillion varieties out there. It doesn't have to be anything expensive or anything, just something that is not pimple forming or non-comedogenic. That's Latin for not pimple forming, non-comedo, pimples, genic forming. And basically just splash, and instead of rubbing dry or instead of scrubbing with a scrubby or of some sort, basically you want to splash and pat, just very gentle patting with the towels, because if you scrub, that irritates the skin, and repetitive rubbing is one of the things that can trigger an acne or a skin eruption as well. So lukewarm water, pat dry, and very small amounts of the medication throughout the face, obviously avoiding the raccoon area around the eyes, because the skin around the eyes is extremely sensitive and prone to absorbing things. And you also have to be kind of careful with the folds of the nose and the folds here a little bit, just because things can kind of get in there and get more concentrated just because it's kind of like folded over on itself. And so with those tips, if you're using one of these acne medications in clinic, usually recommend very small amounts and only a couple of times per week, and gradually move those intervals closer together, so maybe 2 times a week and then 3 times a week, or whatever is needed. Because if you try some of these other diet lifestyle things, like go out and buy some barberries and munch on them, and you get rid of the dairy and you decrease or get rid of the high-fat foods, then between all of those things you'll get a much better complexion as a result of all of it. And so the other thing is that when you're using the medications like the Retin-A or the benzoyl peroxide or the clindamycin, just as some of the more common ones that are first-line treatments for acne, or even some of the over-the-counter ones, salicylic acid, there's lots of washes that contain these things. By the way, if you get prescription medications, better to not use the medicated home medications, because again, too much too quickly can make very, very red, irritated, peeling, sunburned skin. So the idea is that when you're using the medications, using a moisturizing lotion that's very light and that has some sunblock built in can be very, very helpful, because when the skin gets sensitized through using one of these medications, or sometimes people have oral antibiotics that they use for a while, when the skin gets sensitized, you don't necessarily realize how much more sensitized it is right away. And so you're going outside, you're spending your usual amount of time, and the next thing you know, you get baked in the sunshine because of the increased sensitivity of the skin to the medication. So a little bit of sunblock and a little bit of mindfulness, broad-rimmed hats, and that sort of thing can go a long way in keeping the skin healthy. Besides that, sunshine is one of the primary things that causes wrinkles. So just a quick little segue to help reduce the wrinkles over the long run. Not only can you do things like use Retin-A for your other skincare needs, but You can also use sunscreen, not pimple-forming, non-comedogenic sunscreen. And when it's in that daily moisturizer kind of thing, then it can be very helpful. If the skin is sensitive, try to get the brands that say for sensitive skin, and that can be very helpful in the long run as well. So another thing that can help with wrinkles is also eating your fruits and vegetables, especially the ones that have the orange pigments and some of the other highly pigmented vegetables like orange peppers and red peppers and things. Very, very good for the skin. Gregor's got a nice little section on his nutritionfacts.org website, and that talks about some of the specific studies that were done and which fruits and vegetables had the most protective thing. When people eat a variety of brightly colored foods, the pigments are taken up by the body and they actually show up in the skin, and the skin gets like a healthy golden glow from it as well. So another reason to eat your carrots. Alrighty, so we covered repetitive skin trauma or rubbing as a thing that can trigger the acne. We covered dairy as something that triggers the acne. Cosmetics, certain cosmetics can trigger acne. That's why when you're buying lotions and you're buying creams and things, not only should you look for that not pimple forming in Latin tag that says non-comedogenic, but also be mindful that everybody's skin reacts differently to things. It's actually fairly common that women get allergic to some of the dyes and things that are used in things like mascara and eyeliners and some of the blushes and things like that. So generally speaking, if you notice that something seems to be associated with forming acne in you personally, then it might be a good idea to just set that lotion or that aside and not to use it. Sometimes things can get cross-contaminated too, so if there are two women that are sharing cosmetics and one of them gets the brush or the pad, contaminated with the bacteria, and then the other one uses it, they might be kind of transplanting some of that bacteria more directly into the pores. So something that you might want to just be mindful of if you happen to be noticing. So it might be the skin reacting to something in that stuff itself, or it might be a shared kind of thing. Certain drugs, there are certain drugs that do trigger acne as well. Steroids, oh gosh, yes, steroids, kind of going along with some of those hormone things that people get with hormone-style diseases like the PCOS and other kinds of things. Anything that causes the body to secrete more testosterone, especially, or higher levels of steroids in general, or if you're taking steroids, it will trigger the acne. Certain supplements from these supplement shops like GNC and such, they are very well known for basically triggering the hormones, and sometimes people take them because they want to do the muscles and things like that. I gotta say, since the shops are very popular in my particular practice and area, since I've been working here the last few years, I've seen more cases of gentlemen developing breasts or gynecomastia than I had my previous entire 8 years of practice prior to this particular location. And I think it really has something to do with the frequency and the number of times that people are taking in these hormone-laden supplements from the local vitamin-type shop that's in the local area. And so another reason why I recommend actual foods, for health and wellness and using the actual science that we know about for it, rather than trying to take something that's dried and processed and powdered and all that kind of stuff, because it's going to be a lot safer and a lot less likely to cause the gentleman to grow certain areas that they do not want to grow. A couple other drugs, let's see, phenytoin, isoniazid, disulfiram, lithium, some of the B vitamins. If people are taking really mega doses of vitamins, sometimes the B vitamins can also trigger that system as well. The Western diet, we talked about already. Climate, I mentioned that kind of in the beginning. It's Florida, and so in this particular location, it's summertime. You've got heat, you got humidity, and so that alone can trigger the skin to sweat and these pores to block up and clog up and such. Stress, that's actually another interesting one. I've noticed too during times of emotional or other kind of stresses in general, that sometimes a couple bumps will pop up here and there. And so another one, get the privilege of seeing it from both the doctor and the patient side on there. So another reason for practicing stress reduction techniques throughout the day. So diagnosis and treatment, of course, usually it is a fairly common, and so it's usually pretty easy to get that diagnosis down. I have noticed that occasionally people will have a infection of Staph aureus, and they'll think that they've got like a little acne or something, but it's like this big kind of crater forming pustule rather than a little tiny pimple kind of thing. And so if you're seeing something that's actually large and inflamed, sometimes if it's getting big, sometimes they actually need to be professionally drained. And so of course, there's different levels of things. Obviously, I can't tell you, through a camera, what you got personally, but that's where knowing yourself and knowing when to go talk to your doctor can be very helpful. Let's see, so we talked about some of the treatments of acne, the topicals, the retinoid kinds of things. There's a lot of commercial products that incorporate some variation of vitamin A in them. Then the acid preparations, salicylic acid I mentioned, benzoyl peroxide. Another thing with the benzoyl peroxide is if you get that stuff on your clothes, it is a peroxide and it will have a tendency to bleach things. So just be mindful of that when you're using benzoyl peroxide. It can try not to get it on your clothing. And then antibiotics. Sometimes we will prescribe an oral antibiotic for usually around 3 to 6 months or so because it takes that long for it to really get in there. And whether it's really the antibiotic part of it that's fighting off the bacteria or whether it's an anti-inflammation part of it, sometimes those can be helpful as well. I tend to try to maximize other methods first, mostly because when people take antibiotics for a long time, yes, it will help with the skin, usually. And it's particularly useful if people have not just skin, but like chest and back acne. Because if you got a lot of acne on the upper back, for example, and that can be a really hard place to reach with, like, I can't even get it now. That can be a really difficult or challenging place to reach with topical creams and stuff. And plus the anti-inflammation part of the antibiotics can be very, very helpful. So doxycycline, minocycline are some of the more common ones that we use for that. But again, the antibiotics make the skin more sensitive to sunlight and so way more likely to get sunburned. So you don't want to be taking these acne antibiotics and then lie out on the beach and go to town, because you could get very sunburned that way. So be careful. The sun is very hot and you got to be careful out there. Let's see, what else was on there? Accutane. So there are a lot of different treatments for acne, and Accutane is one of the strongest that's out there. And the things that you got to be mindful for with this is it is very good for treating the acne, but it can cause a lot of dry mouth, dry lips, and that sort of thing. The other thing with the Accutane is it's extremely vital that whoever is taking that medication use 1 or 2 or maybe even 3 forms of birth control. The idea is that this medicine is so powerful that it can cause some pretty devastating birth defects. And so there's very few physicians that actually can prescribe it. I believe the dermatologists that prescribe it have to have some special courses and training, and they actually register people in a Accutane database of some sort, so that if somebody accidentally gets pregnant while they're taking it, they can, keep track of and watch for the birth defects and things like that. The other thing with the Accutane is it, again, is very effective for the severe cases, especially when people are getting cratering and such. But if you listen to my earlier part of the presentation where I was talking about these barberries, without having all those severe side effects of the pharmaceuticals, the Accutane, they found that the barberries were about as effective as the Accutane as reducing the number and the severity of the lesions in the first place. So you definitely have to do close follow-up if you end up having to take the route of that medication. So if you're taking it, make sure you have your pregnancy test if you're a girl, or if you're able to have a baby. Not so important if you're a guy, of course. Liver function tests, cholesterol tests, and blood counts. And usually treatment with Accutane is at least 6 months or so. And I think I'm just kind of glancing over my notes pad over here. And that's pretty much the main root of it. Sometimes people that have a higher intake of table sugar or chocolate, sometimes they notice that the acne goes up. And again, that tends to be more with the hormone fluctuations. So when insulin goes up, or when insulin-like growth factor goes up, it triggers the skin to do this as well. And talking about the hormones, yep. So that's pretty much the main stuff that I want to talk about with acne tonight. And it's a very common thing that people come to the clinic for, especially the teenagers. But again, if there's something through simple lifestyle measures that will improve or mitigate it, that usually is better to prevent the disease than to suffer through all of the pain and the misery of, having the disease and all the dry skin and all the other things that go for the medications. Everybody's got to make choices on to what they want to do. So if you're really gung-ho for the ice cream, for example, and don't feel like switching over to the plant-based kind, or a low-fat, gelato or something like that, or even better, frozen berries, they're pretty sweet and can satisfy that craving for the cold, sweet stuff. And you feel that you want to use the medications of various sorts, you know what, that's okay. Everybody's got personal choices and what they want to do and so forth. But anyway, I hope you've enjoyed this talk on acne tonight. The main references for it, again, are Dr. Barnard's nutritionmd.org and Dr. Greger's nutritionfacts.org. I'll put those links and references below. So it's been a pleasure saying hi to you tonight, and thank you for watching, and we'll see you next week. Bye-bye.